That's off your nickel. So that should drive quality, that should drive cost responsibility and things like that. That'll have a big impact. And the last thing to point out, as I mentioned, cost constraints and policy changes will open up new markets. There'll be new markets for new players, and there'll be a lot of opportunity out there. Continua is obviously a big driver in a lot of this stuff. You see the names on the list of sponsors with Continua. It's got a lot of big players. So there are going to be new markets and new opportunities for the folks that can do this. All right, the second tier or dimension for this is revolution in care. Basically, we're starting to see a lot more things pointed directly to the consumer. And I'll give you just a simple example that's paid big benefits. Aetna right now, when you get diagnosed with some condition or you're going to have a procedure done, they will lay out exactly what the typical routine care is for that condition. They email it to you and they email it to your doctor, okay? That's actually had a huge impact on changing the doctor's behavior, okay? Because people come in and say, hey, this says I'm only supposed to get this lab test done every 90 days and you're asking me to do it every month. Why is that, Things like that. So that's a very small step directed directly to the consumer or the patient, and it's having a huge impact. There's going to be a lot more of that. I think we all recognize that the internet has had a huge impact on a lot of industries. It's certainly going to have that on healthcare. There's been some forays into giving clinical information directly to the patient, but I think we're going to see a lot more of that. The other big thing is the personal health record. I mentioned that it's real difficult to know everything about a person's care because the data is in so many different places. The personal health record might be the one place where that all lives, okay? You would probably have to populate some things yourself, but you could get feeds from your lab, you could get feeds from the pharmacy, you could get feeds from the hospitals that have this data, the clinics. Microsoft, Google are definitely in this space. They're trying to figure out how to get those feeds so that you have a robust, comprehensive record of your care. The PHRs haven't really taken off right now because the incentives for the patient aren't necessarily there. Folks that have chronic diseases tend to use them a lot because they are very involved in their own care. But I think what will drive PHRs is if there are real incentives for this. I think we all recognize that we'll do things if we're incentivized to do so. We don't really need a lot. Dr. Kelly at Aetna told me, he's an ex-Navy guy, and he'll drive across town to the naval base to get a prescription for free instead of driving across the street to CVS and paying his $10 copay. I think we all kind of realize we're cheap, but we need something to get us to do things. So if the insurance companies incentivize folks via lower copays or reduced premiums by populating their PHR, we would know a lot more about their care and be able to act on it before people take a downward turn and have a lot more expensive care down the road. Wellness, obviously right now we spend a lot more on the right side in healthcare than we do on wellness. I think what we'll realize in the future is there's a lot more value, a lot more cost efficiency, and a lot better outcomes for the patient if you spend a lot more focus on the wellness side. The difficulty, of course, is getting people involved in the healthcare system when they're well. Right now, 80% of healthcare is performed outside of a hospital, and we definitely see that number will probably go up. So, as I mentioned, we've got a lot of rich information within a hospital setting, but there's so much outside there that's not connected. So it's very difficult to try and find out, how well a patient is doing or how well populations are doing with certain care protocols. We talked about the differences between electronic health records and PHRs. The key there is the one is maintained by clinicians, the other one's maintained by you. I think with the right incentives, PHRs can really have a lot of value. And as we know, Google and Microsoft and others are involved in this, so there's likely to be a lot more investment and movement in this area. It's probably something that will emerge as a real industry driver within the next couple of years. Health 2.0, obviously there's a lot of social networking advancements within healthcare. We've seen in a lot of industries. It's here to stay, which means healthcare will probably adopt this in 10 to 20 years on their current pace. this. This is a little survey that PwC did around access. It's basically asking people, what non-traditional ways would you be willing to receive health care? A lot of people said over the internet, over telephone. The need for health care is outpacing the number of clinicians out there. There's just not going to be enough docs and not enough nurses to see everybody who needs everything they're doing. So we're going to have to find some other methods. I found this interesting that, even the text messages would be a way to, some people are willing to get care from a text message. So we've got empowered health consumers with a lot of information flowing directly to the patient, not through your clinician. That obviously will have a huge impact. You think about like the difference in the travel industry now and in the way it was 15 years ago. Nobody knew anything about the hotel you would go to, and you had no transparency to how tickets were bought or what they cost or anything like that. You had to go see somebody. I don't think we're going to be too far off from that in 10 years with clinicians. They'll help us understand the information, but a lot of the information will go direct to us, and we'll be able to grab anything we need relative to that. We might have trouble understanding it. We might have trouble processing it, but there might be automated components that do that for us. Something to Google. I'm not going to be able to cover it much, but if you look up a medical home, that's something that everyone kind of needs to be familiar with because that's got a huge consumer play. There's a huge impact to reimbursements and physician alignment and things like that to the medical home. And whoever can figure out something to do with all those spokes right there is going to make a fortune. Think of Amazon times 10. There's so much information going around from all these different modalities back to the medical home that there's probably a huge opportunity there for people that figure out the right ways to handle that market. If you look up Blue Sky, that's another good thing to research after today, and I think that it's an example of the medical home. Kaiser Permanente is a leader in HIT in a lot of ways, and this is an example of one of the things they're doing with the medical home concept. So once again, the middle one there is the key. Technology companies have a real big opportunity to provide information, processing it, analyzing it, having it flow to the right places. There's huge opportunity right now. It's only going to get bigger. All right, impact of new science. Personalized medicine is basically looking at your genetic profile or some other component that's similar to that and devising your care based on that. All right, so the current way that most medications are developed and sold post-market is you find out a disease, you discover that a medication works on it, and you give it to everybody who basically has that disease. Most of the time, it's not efficacious for every person. And it has to do with, there's 15 different types of diabetes, and there's, 5 different types of breast cancer, and things like that. They all have genetic components. You have a genetic component that makes you unique. So it's likely that the combination of your genetic profile and the specific molecular activity that this drug works on have a match. So what that's going to mean is you'll probably see a lot fewer blockbuster drugs. They won't be released to the entire population of folks that have diabetes. They'll be released to this specific set of genetic profiled folks. It may be 1/5 of the size it used to be. Obviously, that's going to have a huge impact on the way drugs are brought to market because right now it costs like $150 million to bring a drug to market. And if they're not selling $2 billion a year, they're only selling $200 million a year, they're not going to be able to do that much R&D. So there's going to be a huge change in the way medications and devices are brought to market. And the personalized medicine should have more impactful care with a specific drug. And there should be a better outcome and, of course, less cost because you're not giving drugs to folks to whom that specific drug won't work. So what that requires is a lot more information. Obviously, one of the things is you need to have genetic sequences for your patients. It used to